Everybody, and welcome to the Power of Africa Conference 2022. We are speaking about re-engineering preventative medicine into the healthcare system for a new Africa. But before I go any further, let me introduce myself. My name is Luatile Nkala. I'm the Chief Operations Officer at a company called Doctors eConsult, based here in Botswana. We are a telemedicine platform bringing together doctors, pharmacies, pathology services, and the healthcare sector at large. Before I go any further, let me introduce you to our esteemed panelists who will be joining us as we dissect this topic, preventative medicine in the healthcare system for a new Africa. On the panel, we have Dr. Agba Ashu.
Hi, Oloatile. Hello, everyone. It's good to be here. My name is Dr. Agbo Ashu. I'm from Cameroon. I am the co-founder and medical director of HealthLink. And at HealthLink, we have as mission to help people understand, track, and also improve their health and using digital technologies as a tool. So we simply do that using by doing comprehensive health checks and also offering personalized care plans for different individuals.
Thank you, Dr. Agba. Thank you so much. Next on the panel, we have Her Royal Highness, Princess Dr. Muradina Ugulana.
Hello, it's a pleasure to be here with you. My name is Dr. Muradina Ugulana from Lagos, Nigeria. I'm the founder and CEO of the African Women's Health Project International in Little Rock, Arkansas, with our international headquarters in Lagos, Nigeria. And I bring you greetings from over here.
It's a pleasure having you, Her Royal Highness. Lastly, we have Dr. Hashim.
Hi, everyone. I'm Dr. Hashim Mpati, a medical doctor from Benin. I'm the co-founder of and CEO of Araya, which is a mass health literacy program in Francophone Africa. Very nice to be here with you all. Thank you very much.
Indeed, it's a pleasure having you, esteemed panelists here. I feel so privileged to be here. We are speaking about re-engineering preventative medicine into the healthcare system for a new Africa. I think this is a topic that's long overdue. This is something that a lot of people have been debating about, and it's a question that has been asked a lot of times. Most people think Africa is spending too much on curative care, and others are for the school of thought that preventative medicine is the way we should be going, right? So before we go any further, before we divulge this topic, I think, Dr. Agba, you can start for us. What is preventative medicine?
So I'd like to put it in a very, very simple way. In healthcare, there are 3 levels of medicine. You have the preventive medicine, you have secondary medicine, and you have tertiary. Preventive is more proactive, and the secondary and tertiary are much more reactive. And in preventive medicine, it's about using all of the resources that God has given us to be able to make our lives better. And this involves things around nutrition, around exercise, around sleep habits, even the air we breathe and the water that we drink. How well do we use these resources in order to be healthy or in order to live healthier lives? So preventive medicine is everything around these natural aspects that enable us to live healthier, and they are much more proactive than reactive. So it's very important to distinguish that. Most times when we talk about healthcare, we are usually talking about sick care. That is, we are actually waiting to be sick, and then we go to the hospital, the doctor prescribes us medicines, and then we take the medicines and come for control. When we talk about preventive medicine, it's about how do you avoid getting sick? And it's everything around, like I mentioned, nutrition, exercise, sleep, the use of supplements, and so on and so forth.
Thank you so much, Dr. Agba. That was a very precise and elaborate definition. Indeed, preventive medicine is how do we avoid getting sick. And on that very same note, Dr. Hashim, I have a follow-up question that perhaps both you and Her Royal Highness can answer for me. Do you think that Africa is currently doing enough when we speak about investing or promoting preventative care?
Thank you very much. Maybe I will start. Is Africa doing enough? I'm not sure. building on definition provided by Dr. Agbor, we are more focused on treating diseases than actually preventing diseases. And one thing that may explain it is that sometimes when you invest a lot in prevention, the result is not tangible. You have no proof that the way you are, your healthiness right now is the result of the decisions that you have taken in terms of prevention. But when you are sick, you treat it, you get results, you are not sick anymore. But it is difficult to prove that prevention is working or is the cause of the result you have. So basically, as politicians, as health managers, they focus more on what they can prove as proof of their work than something that is not tangible that they can show as a result of their work.
I am so happy that we're talking about this, the preventive medicine, because we cannot talk about the preventive medicine without actually talking about the climate, the environment, how the environment plays into it. And when you look at a lot of communities in a lot of countries all across Africa, just name it, any country, especially when you look at sub-Saharan Africa, you look at it that, most of the countries actually, I call it that we're playing a shop. You know how you go like to Macy, you go to like a window shop, you go to the window shop, the window is dressed very beautifully. It looks beautiful on the outside. But on the inside, on the back end of it, everything is all scattered and nothing is all planned, like per se. So what I think needs to happen definitely is infrastructure development needs to happen all across Africa. We need to have leaders. We need to have, we have to take a concise effort, not only leaders, but even as NGOs, as companies, as corporations, that has a stake, in the land, in the different places over there that comes in there. They need to take a stake to make sure that infrastructure is built in. Because when you talk about, when Dr. Agbor was talking about preventive medicine, look at, when you don't have the right kind of road, people, they go out, they don't have the right type of road. By the time you go into all those potholes and all that stuff, your body aches and things like that. You walk on roads that's not paved. Somebody accidentally steps on nails. Those are things that don't need to happen. That that the type of sickness that don't need to happen. Or you have water that because of improper drainage, that the water it collects in a certain place, then before you know it, mosquitoes start festing over there, and then before you know it, like this, the mosquito comes on somebody like this, before you know it, they have malaria, the malaria turns into something else. So those are things that we're talking about here. Is because infrastructure, if we don't actually use, put together a strategic action plan to actually make sure that our infrastructure is put in place in order to make sure that our environment plays a part, making sure that those things are put solidly in place, we will still keep on having the same type of results, and we will not get to where we need to get to. And if we keep on, I always say that, we always putting a bandage on a sore instead of putting antibiotic, instead of actually, treating the real problem itself. So definitely we need to look at it. And I'm so happy that, you are bringing this type of topic, this type of conversation with stakeholders like this group of professionals that are on here to talk about it and look at ways that we can work together collectively, as professionals, in different fields. Some of them are doctors. Some are actually medical doctors. Some of us are, NGOs, running NGOs. Some of us are working, for companies. So you have so many different dynamics that comes into place that's going to make sure that we actually have the kind of continent that we want to have.
Yeah. Yeah, I totally understand you, Her Royal Highness. And I'm of the same school of thought. There should be more infrastructure. And as we speak about infrastructure, let's talk about access to healthcare, because part of preventative medicine is actually having proper and adequate or equitable access to healthcare. So let me just take it back to the panel. I think, Her Royal Highness, probably you'd be good suited for this, because I know you have African Women's Health Project International. This is an organization that I know you're the CEO of, and it kind of helps people to have access to healthcare. Tell us some of the challenges that you're facing, because I don't think we can talk about preventative medicine if we don't talk about some of the challenges that we're facing when we're trying to bring about preventative medicine.
Yeah, so our challenges, the challenges varies. I know that one of the things is as the founder and CEO of the African Women's Health Project International, when I founded the organization over 18 years ago, it was as a result of seeing a mother of 6 children with one that she had in her hand that she was still breastfeeding from a breast that had probably no milk whatsoever, and the other breast, stuck, gangrene, oozing and what have you, a clear case of breast cancer. She was battling it, and she still had 6 children that she had with her, all under the age of 9 years old. And this woman, she's never had pap smear before in her life. She didn't even know what that was. So when we formed the organization, it was really to bring equitable access to healthcare for women and children. And we actually went about this whereby we said, well, how do we go about this? We know that, I mentioned infrastructure. Infrastructure meant, building, making sure that, we actually have hospital that works. Not only to have the hospital, but that works, that makes sure that, they have, that has water going, they have running waters, make sure that we have equipment for the doctors, to be able to perform the surgery. We now went about whereby we conducted a 12-day medical mission each year that we actually go on to different countries every year, and that's some of the things that we've been doing for the last since 2003, going to different countries and actually looking at ways that we can be able to help. And we want to, the challenges are enormous, because we're talking about 54 sub-Saharan African countries, and huge. The whole continent of Africa is huge. But but we're starting from Nigeria, because I'm originally from Nigeria. But but we have chapters in different different parts of the continent. So we have chapters in the east, we have chapters in the west, we have chapters and even in the north. And now we just even did some just coming up from Egypt. I just came back from Egypt, just did some signing of agreements over there, so that we can be able to give us some help over there, and even for partnerships, so that they can be able to help the sub-Saharan African countries. But what else? And the challenges, we don't have enough hospitals. We need to be able to get access to that. We need to be able to get access to for the doctors to be adequately equipped, because we have the most brilliant doctors in the world on the African continent, and the West are actually the one that are actually enjoying the gifts that the continent of Africa has, really, because most of the brilliant doctors, and when they come to the West, they come to America, go to Europe or what have you, they are being paid premium. So we need to make sure that they increase the incomes and all. Just a lot of things just needs to happen. But at the base of it is just really the infrastructure. We need to build up, start from the bottom and build up from there. And as we join forces and do that, we will start seeing some positive outflows from that.
Thank you so much, Her Royal Highness. I know back here in Botswana, we are actually facing similarly the same problems. There's not enough infrastructure, there's not enough hospitals, and I think that's why we're trying to leverage on technology here in Botswana. So that's what we're trying to do. We're trying to use telemedicine platforms. So as we're speaking about that, I think Dr. Agba, I would ask you, what do you think actually needs to be done to try and integrate this preventative a medicine approach into Africa, seeing as how we have so many challenges as at now? So what do you think needs to be done?
I think this is supposed to be multi-level and at different levels, beginning from individuals to organizations. When we start with the organizations, beginning with the government has to integrate this as part of their health program and incorporated into the health system. The second thing is that when it comes to the government, we could build facilities that are focused just on preventive medicine. If our hospitals, because our hospitals are focused just on curative medicine, the doctors wait for that, for someone to get sick, and then they prescribe the drugs. But facilities, such as what we have in Healthly, which is the first preventive health facility, where we do health checks, and we give you personalized plans, care plans, not based on drug prescription, but based on a lifestyle transformation. We need many more of such facilities to be able to integrate this in our system. When it comes to in medical schools, this has to be integrated as a full-time program in terms of training medical practitioners on preventive health, in terms of lifestyle medicine. It is part of the curriculum today, but this is just a little part of it. Meanwhile, today, a lot of people are becoming more and more conscious about their health. A lot of people are becoming more and more conscious about the things that they can be able to do to improve their health. So in the medical school, we have to train doctors and even specialists that are focused just on preventive health care. When you come to the health insurance and the different HMOs, it is very important that we include preventive health as part of the insurance schemes. Many insurance companies today is about curative care. Nobody covers for the health checkups that people go to the hospital. When people go to the hospital, everyone focuses on when you fall sick. Meanwhile, when insurance companies focus on preventive health checks, for example, it's even much more beneficial because it prevents people from getting sick, and it helps them and it reduces the amount of health expenses that are being carried out. The various organizations that we have, can we preach more around preventive healthcare versus just Dr. Hashim has the health literacy. It's all about preaching health education, because this is what the general population needs to be able to adapt themselves towards that. To the farmers, can we produce healthy diet? To those that are around, can we ensure that our environment is clean? It's multi-level, but this requires education, it requires lobbying, it requires doing one step at a time, and it needs a lot of, it's not supposed to be independent, it needs a lot of collaboration in order to be able to achieve that and reintegrate and re-engineer preventive medicine into our healthcare system. So those are just a few details of what I see that can be done in order to be able to integrate preventive medicine for a new Africa.
Thank you so much, Dr. Agba. I think from what you're saying, I'm getting a lot about health literacy. I know that we are speaking much about infrastructure, but you're also speaking to the issue of health literacy. And it seems to be something that's not common in Africa. A lot of people don't have a lot of health literacy. So I think, Dr. Hashim, take us through that one. How can health literacy actually contribute to preventative medicine?
Thank you very much. I'm very happy to be speaking just after Dr. Agba, because he sets the path to what I'm about to say. So true, we have actions at different levels, at community level and at individual level. And at community level, we have a lot of things together. Preventive medicines is very comprehensive and includes all other sectors that Dr. Ogunlana highlighted. So it's about agriculture, it's about education, it's about sanitation, etc. Unfortunately, to talk of insurance, Dr. Agba talked about the private insurance, but there is a trending now in sub-Saharan African countries about universal health coverage. And even there, in the benefit package that people are building, you will not see a preventive aspect of it. It's only we cure this, that, etc. And it's all that is never about preventive medicine. So that's about the community level. At individual level, most of the prevention aspect is about behavioral change, lifestyle change. And before coming to that, people need first to know about what to change, what to do right. Most of the time, ignorance kills more in Africa than diseases, most of the time. So first, people need to know what they are doing wrong, what they are doing right. And that does not guarantee that they will do right what they should do right. But at least it is the first step to make sure that they know about what they should do. And that's what we have been doing in with Araya. So I have a very sad history. I was very depressed at hospital around 2016 because of things that I was experiencing with patients, with histories, with a lot of sad events that happened to families. And I was so depressed but I felt that I needed to do something about it. And with some colleagues, we set up Araya, which is a mass health literacy. So Araya in Yoruba is health is there. It's a Yoruba language, which we share with Nigeria, Benin Republic share with Nigeria. So our aim was to provide people with basic health information that was focused on health challenges that we have in Benin, and that built on people's language. So we focus on local languages as well as French, which is the official language, but most of our population is non-alphabet. So we had to add our local languages to our strategy. So we started in 2017 with information leveraging on local languages and information technology, as well as radio stations and television shows. And very shortly, what we noticed was that a lot of people, there was a lot of uptake, a quick uptake from people. And very soon, within few months, we have thousands of people that follow us, that ask questions and that get reply all over the Francophone Africa. So that was not something that was planned. We was focused. We have started with Benin, but we've noticed as lesson learned that people from all over Francophone Africa and even beyond, but the majority in Francophone Africa were interested, asked questions, get engaged. And a lesson we can learn from that is that there is a need. People want to change, or at least know what to do right to maintain their health. So unfortunately, we are not tapping enough on that. And to give an example is about COVID-19. We had an opportunity, a lifetime opportunity to introduce hygiene into people's behavior. With COVID-19, there has been a lot of sensitization around wash your hands, etc., and hygienic information spread to people. But today, anyone is not speaking about it anymore. I thought that it was an unique opportunity for our government, for health managers, etc., to take opportunity on that, to maintain it on the long run, because hygiene, hand washing only can reduce drastically a lot of diseases for which we invest a lot of money. So right now, nobody is speaking about it anymore. People are not comparing compelled to wash their hands, and even the devices that people put in before their offices to force people to wash hands have started disappearing. I'm sure that it's the same thing in other countries in Africa. So I think that from now we still have challenges on the decision makers level, to really take into consideration and consider what prevention can bring into the health system landscape in Africa. Thank you very much.
Thank you, Dr. Hashim. This is something that you're so passionate about. And like you said, I think, yes, it was a missed opportunity from COVID-19. These measures should have been there. They should now have been the norm across Africa, even beyond COVID-19. They would promote preventative measures like washing hands. All of us were now so used to washing hands. They should have just kept it like that so that we are all now just accustomed. And you're right, it would actually have prevented some of the diseases and some of the sicknesses that people are facing just from hand hygiene and eating healthy. You know, during COVID, we were actually promoting how people to eat healthy. We were actually taking a lot of vitamins. I know I was taking a lot of vitamins because it was said to stop COVID-19. So you're right. I think this is something that they should have continued. The narrative should have continued. Keep taking your vitamins, keep taking those vitamin C's. I think you're very right. That was a missed opportunity on many governments. And maybe this is a conversation they should now be having. It would actually reduce the spend that we are spending on trying to now cure diseases, because Africa's taken more of a curing when things go wrong, right? So I think you're totally right. I know we have a lot to say. A lot of us have a lot to say, but unfortunately, time is not on our side. I would have loved to extend this. You know, I would have spoken more about technology and preventative medicine, because that's an area that I'm very passionate about. But unfortunately, time is not on our side. So maybe I can just give each panelist about a minute to just give their closing remarks. Dr. Agba, you can. Okay. Her Royal Highness, you may go ahead.
Oh, I was just going to just piggyback, and that can be my royal my closing remark, is the fact that, you know, that can actually be a challenge from us or from this discussion, because whatever panel discussion that we have and all that, so we need to come up with a challenge after that, because we can actually lead it. Because what's stopping us on this panel right here from actually creating a challenge like this, you know, to continue on that healthy lifestyle type of challenge, you know, and put a call to action. And it can be something that we can actually do as this, you know, we're 4 of us on this group, but, you know, but with 4 of us, you know, and I know that with 4 of us, there's thousands of people behind the scene of people, of these 4 people that's on here, that we can actually put a call to action from, because we, sometimes with Africa, especially on the continent of Africa, we can definitely not wait for our leaders to actually make decisions, especially when it comes to our health and our livelihood and our beings. We have to, we have the will to be able to take some decisive actions, and this is something that we can make a call to action, and then we will see what comes out from there. And I think that is something that I'm challenging each one of us on here. Let's do this. Let's start a call to action plan, and it could be from the Power of Africa platform to actually do that, because that can be a start. That needs to be a start, because that was something that worked. During COVID, when people started washing their hands and all, even me, I remember too that I used to have asthma attack before. I used to, especially over here, especially I'm over here in Houston. I have a home in Houston here. When during springtime like this, I'll start sneezing uncontrollably, just really have, real bad, flu or what have you. After COVID, I've not had one single cold because of, even the wearing of the mask and the whatever and all that. I've not had that, from washing hands and all those. So it goes to show you that something worked there. Let's examine it. Let's see what works there, and let's put a call to action on it, and let's continue it. and it can be for a better Africa. Thank you.
Thank you so much, Her Royal Highness, Dr. Agba. Your closing words?
Yeah, so I mean, it's really amazing being part of this session, and I believe that those that are here at their various levels are championing preventive medicine at the different levels, and I believe that to everyone that is listening to us, preventive medicine is the way that is going to keep us alive and strong, and even the way to go. It is what is going to keep us in our offices to be able to make these decisions that we are making at the moment. It's because of preventive medicine that we are even able to stand here today, because we are healthy in order to be able to speak at these conferences. So it's very important that we begin to prioritize these aspects of preventive medicine in our various systems. And like I said, I mean, it's amazing to have these wonderful and esteemed speakers on the panel who are doing things at a different level. This is a start, and we need to push these to the ends of the earth until many and many more people begin to integrate these healthy lifestyle practices as part of their lifestyle, as part of their daily habits, and part of their daily attitudes. Thank you so much.
Thank you, Dr. Agba. Dr. Hashim?
Thank you very much. It was so nice to be in this panel. As closing remark, I would just like to stress on equity. Equity is a huge challenge in healthcare sector across Africa, and preventive medicine is an opportunity to close the gap of equity in Africa. And we know from the WHO, World Health Organization report called Health Literacy Solid Fact, that inadequate health literacy increase resilience. Inadequate health literacy increase existing inequalities and increase healthcare expenditures among individuals and community. And we know that health literacy increase resilience among individual and community, and that health literacy is a better predictor of health, better than education, than income, etc. So that is an opportunity to tap into its potential for preventive medicine, and more broadly for better human resources in Africa, healthy human resources in Africa, able to contribute at their full potential to the development of our continent. Thank you very much.
Thank you so much, Dr. Hashim. I feel obliged to give a recap of what I thought about the panel discussion, right? Thank you so much. We were with these highly esteemed panelists. And I think, as what I would say is, I'm a tech enthusiast. I love technology. So I would also think that technology should be fused in providing preventative medicine, right? Her Royal Highness spoke about the access to healthcare. I think technology is one of those things that can actually bridge the gap. You know, we can use telemedicine platforms. And I know a lot of times the argument or the debate is maybe Africa infrastructure, internet is not good. There are ways around that. You know, we can use USSD services that don't require internet. People are using drones to collect specimens, all those types of things. You know, I think technology can also be leveraged to actually attain preventative care, right? Because some of the challenges, especially like here in Botswana, we are facing a huge challenge where their argument is they can't go by preventative medicine because we have a shortage of doctors, we have a shortage of infrastructure, like she just said, right? So they're saying that it's better to deal with the situation as it arises, right? But I think that's totally wrong. I think we should take a preventative approach, introduce technology where we can to assist and to provide health information, like you just said, you know, and stuff like that, just to increase awareness and just use technology to better the preventative methods, right? That's my opinion about the subject. Her Royal Highness, I don't know if you want to add in there. All right.
Yes, you said it right. Definitely, technology is the way forward, because everything that's going to happen now, we're in the world of technology now, and we have been blessed to have it. So definitely it has to be weaved into everything that we are planning to do. So thank you so much, and thank you so much for having me on this platform, and all the great work that you're doing in Botswana. I would love to be able to partner with each and every one of you. And to my brother over there in Benin, my grandmother is actually from Benin. So so and with there are Yoruba right there in Benin. I'm a Yoruba princess, so that's my neighbor over there, right there. And Dr. Agbo, it's a pleasure to meet you, and would love to actually get more with you, because we are actually all speaking the same language, and I would love to see how we can weave everything together, and with technology be able to transmit it together, and especially with our Africa 259 project for the whole continent of Africa. Thank you all so much.
Thank you so much, Her Royal Highness. And I think, having said that, that concludes our panel discussion. It was so informative. I feel so privileged to actually have heard this panel discussion amongst esteemed panelists here. The submissions were great, and we're taking a lot from this panel discussion. On that note, thank you so much.